Wondering how dental crowns are made and how they actually glue the crown onto your tooth? Let's talk.
Dental crowns can be gold, porcelain fused to metal, so it's mostly white but there's metal underneath, or all ceramic, all white. A crown is something referred to as a cap, since it literally is placed over your tooth just like a cap. However, before they even ever place this new crown or cap on top of your tooth, they have to prepare your tooth first. So to prep the tooth, similar to a cavity filling procedure, the tooth decay needs to be drilled out of the tooth. The reason a crown is necessary is usually because the decay is too big, or there is not enough tooth surface left to successfully place the filling, like you see here. So to protect a weak tooth from breaking, a crown is the better option to restore your tooth so it will last. Once the tooth decay is all removed, then they will prep the tooth for the crown. They shave down the tooth into a shape that will allow the crown to cover or cap right on top of it. And then, as you can see, the tooth will look like a little stump or a little stub. Then they will either use cord to pack around the gums of the stump, as you can see here, but no worries. I know it looks intense, but you won't feel any pain because they will numb you up beforehand. Sometimes you'll feel some pressure, like you'll be aware they are working in that area, but you won't feel any discomfort. And other times, in some offices, instead of using the cord, they may even use a laser, like you see here. So they will either use the laser or pack the cord. Next, they might place a material around the gums to prevent any bleeding. And now, although your tooth is almost ready, before they can place a crown onto your tooth, they have to make the crown. And to make the crown, they will take an impression of the prepped tooth stub. Oftentimes, they will take either a digital impression, like you see here. Digital impressions are mostly replacing the old school impressions nowadays in most offices, but in some situations, they still may take the old school traditional impressions. Now, if they have a digital scanner, the dentist will design the crown in office, and sometimes they will even fabricate the crown itself in office as well if they have a milling unit. So if they have a milling unit, they will place a block of ceramic into the milling unit. The total milling process time depends on the unit and the block material that is used, but for example, the machine in this video, it usually takes about 15 minutes to make your crown, which is pretty quick, pretty cool. So if your dental office does have the milling unit, you'll get your permanent crown the same day. Or if your office chooses to send out your crown impressions to a dental lab, then you would receive a temporary crown that first day, and then you'll return back on another day for another appointment to receive your permanent crown from the lab. So either way, whether it's in the lab or in office, they will take it out of the milling unit and they will most likely steam it. And then depending on the material of the block, some will need to be stained and glazed and then put into a furnace to harden, and others are already strong and they're already the correct tooth color shade. So either way, once the crown is ready, then your dentist would simply adjust it and polish it before they cement it or bond it onto the tooth stub in your mouth. And before they can cement it or bond it, they need to prepare the crown by etching it, rinsing it, and priming it. So now the crown is finally ready. Now the tooth stub just needs to get ready as well. So once both the crown and the tooth in your mouth are prepared and ready, they're ready for each other, then the crown will be capped onto the tooth. They might use a brush to remove residual bonding material around the crown before they harden it, and then they will use the light to light cure it, aka harden it. Then the dentist will usually use an explorer to remove any residual hardened pieces of the bonding material. Then they will check the margins with the explorer and with floss. And lastly, they may spread liquid on it, which prevents staining and helps cure and harden everything. And then you're done. You have a new crown.
I hope you enjoyed this video. Please like, subscribe, and turn on the notifications if you did. And until next time, I'll see you on Instagram @TeethTalkGirl. Peace, love, and teeth.